Assalamu alaikum. So in this video our major concern would be to discuss about follicular thyroid carcinoma or follicular thyroid adenoma. In order to know the morphologies of adenoma as well as carcinoma, you must know how a normal follicle looks like. So here is a slide of a normal thyroid follicle. You can easily appreciate here that there is a single layer of cells and in inside it there is colloid. Here is another normal thyroid follicle, another normal thyroid follicle. Okay, so you can take screenshot if you want to know the difference of follicular adenoma and carcinoma. I will explain it in the next video. Okay, so here it is a beautiful description of follicular thyroid carcinoma. I must tell you, or I must tell you before explaining other terminologies, that in order to know the difference between follicular adenoma and follicular thyroid carcinoma, only and only one single feature that you must know is that carcinomas do capsular invasion, but adenomas don't do capsular invasion. If anyone says you that differentiate between adenoma and carcinoma, the one answer that you must give is that I will see the capsular thyroid interface first, and then I will tell you that either it is carcinoma or it is adenoma. Okay, so here you can see that there is crowding of follicles. Okay, you must be knowing that in any carcinoma or in any type of tumor, there are multiple divisions of the cells or a normal structure. Like I have shown you in first slide that what a normal follicle looks like, but here you can see that there are so many follicles, or you can say that there is crowding of follicles. So it is not a normal structure. There must be existing any pathology, and that pathology is follicular carcinoma or adenoma. You will say with confirmation that either it is adenoma or carcinoma after seeing this capsule. If this capsule is intact or this tumor is not invading this capsule, you must say that it is adenoma. But as in this picture, this tumor is invading this capsule is not intact now, so you can say that it is follicular carcinoma. Okay, and around it in light pink color is normal thyroid tissue. Okay, so now here you can also see that this tumor is invading this capsule, so it is carcinoma, not adenoma. Okay, after seeing this capsular interface, you can say that it is adenoma or carcinoma. How can you say that it is follicular thyroid adenoma or carcinoma? As you can see here that cells are arranged in the form of follicles. Follicle is just like this, and around it normal cells are arranged. But as it is a tumor, so here the cells must be having some carcinoma like features, like pleomorphic cells, or like abnormalities in cell size and shape, etc. Here again capsular invasion is shown, so carcinoma. Here again capsular invasion is shown. This is capsule. Okay, cells are arranged in the form of follicles, and here is capsular invasion. Capsular invasion can either be minimal or widely invasive in the case of follicular thyroid carcinoma. Here the capsule is beautifully intact. You can see here, no, either not any single cell is invading this capsule, so it is follicular adenoma, not carcinoma. Again capsule is intact here, again capsule is intact here, and again this is a beautiful description. You can take screenshot again that it is fibrous capsule, and here are follicles, closely packed follicles that are lined by low cuboidal to columnar cells, and it is intact fibrous capsule, so it is adenoma. And here is the surrounding thyroid tissue. Okay, or you can say the normal thyroid tissue, but as it is carcinoma, so it is compressing this normal thyroid tissue. Again here the capsule is intact. Okay, again this capsule is intact, so it is adenoma. This is also another picture of follicular neoplasm. Here it is a picture of your big robbins. You can see that sorry, here you can also see that follicular adenoma is just like a solitary nodule or well circumscribed nodule, and its color is also red to brown. Here adenoma, it is follicular adenoma. How you can say that it is adenoma? You must know, or you must be knowing already, that in any type of, in any sort of adenoma, the structure or the tumor just looks like normal structure. You can see here This is follicle, this is follicle, and it is more or less looking like that normal slide as I have shown you before in the very start. Okay, so it is resembling just like that normal thyroid follicles. So but here there is crowding of cells. Okay, here there is crowding of cells, not like it, not looking like a normal structure, but more or less it also resembles the normal structure. So it is follicular adenoma. As it here capsule is not shown, so you can see here that it is arranged in the form of cells, are beautifully arranged in the form of follicles. However, in the case of follicular carcinoma, cells do not retain their follicular structure. Here the cells can either be arranged in the form of trabecula, in the form of sheets, or in the form of nest, etc. Here you can see that it is a follicle, but not so many cells are arranged in the form of follicles. But one feature you can see here is that this is colloid. This is colloid, very much prominent colloid, and it is a reminiscent of the normal thyroid structure. Okay, so by seeing it, you can easily say that it is follicular carcinoma. Again, your robbins is showing that picture that it is intact capsule. So adenoma, here cells are arranged in the form of follicles, so it is follicular adenoma. And here minimal invasion is shown. This is capsule. Here minimal invasion is shown, so it is follicular carcinoma. Okay, so again, let me come back. Here is the difference that adenoma is a benign tumor. It is follicular carcinoma is obviously a malignant tumor, and prevalence, it is more common and it is uncommon. It is common in women under 40 years of age. All the thyroid related issues are more or less, we can say that they are very much common in women, as you have also seen many women with some hormonal issues. Okay, so this is carcinoma, and in women with 60 years and older, carcinoma occurs. Follicular adenoma neither do capsular invasion nor it do vascular invasion, but follicular carcinomas do. In treatment of adenoma, we have to do surgery, but in treatment of carcinoma, we have to do surgery plus we have to do radiotherapy. Thank you very much.